The next piece of vital safety equipment is the portable positive pressure oxygen delivery system. This unit has been specifically constructed and designed for use in a dental office. It allows you and your team to provide positive pressure oxygen to a patient who's not breathing on their own. There are additional attachments that will allow you to provide supplemental oxygen to a patient who is breathing on their own but has a decreased oxygen saturation. The location of this emergency equipment should be known and readily accessible to all team members. The only maintenance this system requires should be to check the oxygen pressure on its tanks on a weekly basis.
Carla, are you okay? Carla.
Carla, are you okay?
Confirming the patient is unresponsive and not breathing. Position, airway, breathing. Now the doctor's checking for circulation.
There's a pulse, but she's not breathing. Call 911, get the emergency oxygen and emergency kit.
If there was no pulse, then an AED would also be requested. The doctor will be identified as the airway manager and the assistant as the ventilator. The assistant brings in the emergency equipment and determines the appropriate size of an oropharyngeal airway by measuring from the corner of the mouth to the front of the ear. The doctor, the airway manager, places the oropharyngeal airway by inserting it upside down and then rotating it downward after it reaches the soft palate. The ventilator has opened the CO2 detector pouch, placed the CO2 detector between the mask and bag valve assembly, pressing it together and giving it to the airway manager. While the airway manager is placing the mask appropriately over the nose and the mouth, the assistant is turning on the emergency oxygen valve and adjusting the flow to 25 liters. The doctor reminds the assistant how often to do the sequence.
Every 4 seconds. 1, 2, 3, 4, squeeze. 2, 3, 4, squeeze.
Squeeze the bag completely once every 4 seconds while observing the rise and fall of the chest as well as the color change of the CO2 detector. If the chest is not rising and falling or the CO2 detector is not registering adequate ventilation, then readjust the mask for a better seal. After 1 minute, check for consciousness and spontaneous breathing.
Squeeze, 2, 3, 4. Squeeze, 2, 3, 4. Stop compressions. Okay, she's breathing. She's got a pulse.